As you all know that Dr. Manish has presented so many brilliant papers in this forum. He is one of the chief moderator in our session, and he used to a lot of presentation in various seminars also. He has published 15 articles, and that are all, I mean, are very, very important one. And he has published articles in Hindi as well as in English. His thesis during MD is Kent repertory and Chena corpus. Yes, completed his internship of thesis on Chena corpus and MD of thesis of Kent repertory with the significant sample size. He has selected SDSS research on breast cancer. His research on breast cancer and its mechanism was selected for the CCRH STH program. He has worked as a data collector for KAB survey. He has worked as a data collector for knowledge, attitude, and behavior survey regarding the lower urinary tract diseases in male, and it was a significant experience for him. He is working now as the main chief medical officer, and he has a lot of patients with him. He is from Varanasi, and he has completed his MD in homeopathy, and later he has worked a lot of good things during COVID period for patients who have suffered with COVID as well as other diseases. He is working as an assistant professor also. He is the assistant physician at Divine Homeo Clinic, Varanasi. This is all about Dr. Manish Azad Singh, and he has presented some of the brilliant papers on personality disorders, various personality disorders. Today, he will be talking about borderline personality disorder. So let us begin the session. We proudly welcome Dr. Manish to this session. Welcome, Dr.
Thank you, sir. Thank you. Thank you very much. So please make me the co-host. Is my screen visible?
Yes, yes, everything fine.
Thank you. Thank you. Thank you. Firstly, thank you, Sani sir, and thank you, Dr. Dhanesh, for giving me this chance to speak again on this prestigious platform of IFPH. And as we have discussed again and again, that I have been discussing types of personality disorder, and this is type B, cluster B personality disorder again, understanding borderline personality disorder. Previously, we have discussed already on this platform histrionic personality disorder, narcissistic personality disorder, antisocial personality disorder, and today we would be discussing borderline personality disorder. Firstly, let us understand what are personality disorders. I have already discussed this before 3 times, that personality disorders are a group of mental health conditions characterized by enduring patterns of behavior, cognition, inner experience that deviate significantly from cultural expectations. So basically what it is trying to say is that there are a proper society norms that a person should behave in a certain way. Okay. So if a person is not behaving in that certain way on the basis of pattern of behavior, or on the basis of recognition, or on the basis of inner experience, then that would be termed as a personality disorder. And this would not be decided in a month or in a day. This should go on for at least of 6 months, or for 10 months, or for a year. Okay. you cannot diagnose a personality disorder in a month. Okay, if a person is having a behavioral disorder from a month, then that would not be personality disorder. Okay. These patterns are pervasive and inflexible, often leading to difficulties in adapting to different situations and relating to others. Okay, so basically, personality disorder is what a person cannot adapt in a different kind of situation on the basis of different stimulus. Okay, so if he cannot adapt that, then only he would be displaying different type of behaviors, and that would be noticed by a physician. Okay, and that noticing can help you diagnose that particular personality disorder. Okay. There are several different type of personality disorders, as we have already discussed and as we have been discussing. We diagnose this personality disorder on the basis of DSM-5, and this is the classification system commonly used by mental health professionals. So people were asking me that how much personality disorders or how many personality disorders are still left. So let's see that. Firstly, in cluster A, we have order eccentric personality disorders. Okay, so there are three types of eccentric personality disorders, that are paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Okay. Since I like dramatic, emotional, or erratic disorder first to explain, so there are cluster Bs. And I have discussed all the three remaining on this platform only: antisocial personality disorder, histrionic personality disorder, and narcissistic personality disorder. Today, we are learning borderline personality disorder. So cluster B personality disorders consist of these four. Then there is cluster C, anxious, fearful disorders. There are three types of anxious or fearful disorder: avoidant personality disorder, dependent personality disorder, and obsessive compulsive personality disorder, which we all know as OCDs. Okay. So there are three types in cluster C. So 3 in cluster C, 3 in cluster A, and 4 in cluster B. As we have already discussed 4 in cluster B. So from rest now on, if I would be discussing this more, then there will be 3 from cluster A and 3 from cluster C. Let's coming back on the topic. What is a borderline personality disorder? So borderline personality disorder basically falls under broader category of cluster B. As we have already seen, DSM-5, on the basis of DSM-5, it resides in cluster B type of personality disorder. Okay. Cluster B personality disorder are characterized by dramatic, emotional, and erratic behavior. So what we have been discussing in personality disorder borderline, we would be what we would be assessing would be erratic behavior or emotional behavior, dramatic behavior. Okay, so that this would be a type of behavioral disorder. Borderline personality disorder is distinguished from these other cluster B by its characteristic features as intense and unstable relationships. So what we would see that the relationships which these medicines or these persons form, these patients form, that would be unstable. Okay. These persons would be having identity disturbance, emotional dysregulation, and recurrent self-harming behavior and suicidal ideation. So in the modern society, in this 21st century, in this 2024, this personality disorder is the most common which can be seen. Okay. People are having identity disturbance, people are having unstable relationships, they are doing self-harming behaviors, and suicidal tendencies have been increased dramatically. Okay. So this is the personality disorder which can be commonly seen in your clinic. If you are able to diagnose this, then you can sincerely understand that a patient who is sitting in front of you could be borderline personality disorder. The rest of the three, which we have already seen, histrionic is the most common in females, and borderline personality disorder is the most common in 2024, the present situation. Okay. While there may be some overlap in symptoms and behavior among the cluster B, because maximum symptoms are matching, each disorder has its own distinct diagnostic criteria and clinical presentations. Now let's deep dive in the symptoms and characteristics, that what are the different symptoms which can be seen in a patient suffering from borderline personality disorder. So in borderline personality disorder, it can be characterized by instability in mood, as we have already read. There are many mood swings, there are behavioral changes, self-image and interpersonal relationship is always important, and individuals with BPD often experience intense and unstable emotion. Okay. They have difficulty in regulating their emotions and struggle with maintaining stable relationships. So in a day, they would feel that they love that person very much, and in another day, they will feel that no, this person do not love me and I deserve better. Okay. So the person will always have a struggle in maintaining a normal relationship. Okay. Some common symptoms: intense and unstable emotion, as we have already read, intense and unstable emotion. Okay. Let's read this. Individuals with BPD often experience emotions more intensely than others, and these emotions can change rapidly, as we have already been discussing, that the people here would have changing or swinging emotions. Okay. And they might feel intense anger, intense sadness, and seemingly minor triggers can escalate the situation very quickly. Okay. So if I have been talking to you and in a second I get rude and you started to killing me, that, oh my God, how dare you talk to me like this, and I'm going to murder you. Okay. That kind of unstable emotion and intense emotion we are talking about in borderline personality disorder. Okay. A minor word or a minor emotion can escalate the situation very quickly. Okay. So the first symptom would be intense and unstable emotion. The second would be unstable relationships. Okay. One of the hallmark feature of BPD is difficulty in maintaining a stable relationship. So if you would be talking to a patient and he would be sincerely telling you round and round that I don't have friends, I don't have people around me, my brother don't love me, my father don't love me, my sister don't love me, then you have to understand that this person has a problem in maintaining a relationship. This person always have a tendency to make unstable relationships in his life. Okay. And that would be helpful in diagnosing him if it is a borderline personality disorder. This black and white thinking can lead to frequent conflicts and difficulties in maintaining healthy boundaries. Okay. uh, Basically, a borderline personality disorder, a person would be idealizing or non-idealizing. Okay. They do not have shades of gray. Okay. They would either be considering you as a god who is unable to do anything bad, or a person who is very bad, or who is very devious, or who is a devil. Okay. There is nothing in mid. Okay. So that is why they have this instability or instability in forming a relationship. Another symptoms: distorted self-image. Okay. As we have been discussing, this has got on peak in 2024. Distorted self-image is very much important in this century. Okay. People with BPD may struggle with sense of identity and have a distorted self-image. They may feel uncertain about who they are, what they want in life, what their values are, and their lack of cohesive sense of self can contribute to feeling of emptiness, confusion, and about their place in the world. Okay. As when we see towards the West, we know that they have identity crisis, and they do not want to be called as he or she. They want to be called, someone would like to be called as they, someone would like to be called as trans, and very much many people. Okay. So what I am trying to say is, a person suffering from borderline personality disorder has a distorted self image. Okay. Then the next is impulsive behavior. Impulsive behavior is very common in borderline personality disorder. This can manifest in various ways, okay, such as reckless spending, substance abuse, binge eating, self-harm, and risky sexual behavior. Okay. Impulsive behavior is not only behaving impulsively as fighting or impulsively striking. Okay. This can be seen as recklessly spending also. If someone is recklessly spending his all amount of money which he has in his bank for a month, for instance, let's understand that there is a student who gets 10,000 per month. Okay. And he's recklessly spending that 10,000 in the first 10 days of a month. Then how will he take the rest of the 20 days? Okay. So that is impulsive behavior. That is behaving without thinking about the repercussions. That there could be substance abuse, there could be binge eating, there could be self-harm behavior, and there could be risky sexual behavior. Fear of abandonment. This is very important in behavioral personality disorder. There are people who are fearing of abandonment. This is the central theme of BPD, that the people who are suffering from BPD always think that people are abandoning them. Okay. The rubric, which if we think in synthesis repertory, would be abandonment. Okay. Or ailments from abandonment. So there is always a fear, a behavior, and emotional reaction on the basis of that the people should not abandon me. Okay. So they would try to behave as such that the person would not abandon him or would not forsake him. Okay. So they always have a forsaken feeling inside them. This could include clinging behavior. So there is a line written, avoid real or perceived abandonment, including clinging to relationships. Okay, we have seen some people in our life who are clingy in nature, who are very doubtful that do you love them or do you not love them. They are very suspicious that do you like it or do you don't like it. Okay, so that kind of behavior is accompanying with fear of abandonment in the base. Okay, and we have to look inside that. Then there was becoming overly dependent on others. Obviously, that is clingy nature. Engaging in manipulative behavior to keep people close. So manipulation on the basis of making people, on the basis of keeping people close to yourself. Okay, so they try to manipulate, they try to lie so that they do not get left alone. Okay, then there is dissociation. Dissociation is what? It involves a disconnection from oneself to one's surrounding and is a common experience for some individuals with BPD. Okay. So what is that? They sometimes get disconnected to the environment in which they are sitting. Okay. So if they are sitting if a person is sitting inside a crowd and the room is filled with his friends, suddenly he can feel dissociated. If he's a person who is suffering from BPD, then he can feel dissociated that I am alone in this world. No of my friends loves me and I am born alone and I would always be alone. And that could be present in a person who is suffering from BPD. Okay. He could be dissociated from himself also. Okay. He can feel that I am a person who is a prisoner in this body and my soul is a prisoner in this cage. Okay. And this could be a feeling inside a person. So now if we try, why I was talking about it is manifesting in 2024, because we have delusions, we have rubrics of in synthesis repertory, which is full of delusions. Okay. And there are many delusions that are present inside cage and present inside body and feeling like a prisoner. And these are the dissociations which we are talking about. Okay. So many homeopathic remedies, if we get inside that core, then many homeopathic remedies are there which can be used. And we would be talking about that further. Okay. Dissociation is usually can be a coping mechanism also. Okay. In response to stress, trauma, or overwhelming emotions. Coming to the causes, as the rest of the cluster B, in this also we don't have borderline personality disorder are not fully understood, but it is believed that it is a result from a combination of genetic, environmental, and neurobiological factors. And let's understand that factors. Okay. First is genetic predisposition. Okay. Always in a mental disorder, firstly understand this, that in a mental disorder, if a father and a mother both are suffering from some mental diseases, then there is 75% chance that the offspring would also be suffering from that disease. And if only one parent is suffering, who is a close relative, then there is 35 to 40% of chance that the offspring would be suffering from that. Okay. So there is evidence which suggests that genetics play a very important role in development of BPD. Individuals with a family history of BPD or suffering from other mental health disorders may be at higher risk of developing that condition themselves. Okay. So firstly, we have to understand that if a family is suffering from some personality disorder or some mental issues, then the offspring could have a higher risk of suffering with the same or a very different mental disorder. Then, as we have discussed earlier in previous my lessons also, that early childhood experience is very important in development of any mental disorder. As we are talking about BPD, there is early childhood experience, and that can be important also. That could be adverse childhood experience such as neglect, abuse, physical, emotional, or sexual, any kind of abuse, unstable family environment, traumatic events, and that could be associated with development of BPD. And we also have rubrics for this also. As the people who are watching me right now live, I can't see participants number, but people who have read repertories know that we have rubrics for each of these: neglect, abuse, unstable family environment, traumatic events. We have rubrics for all of these. These experiences can disrupt the development of emotional regulation skills. Obviously, if a child is suffering from physical or traumatic abuse for a longer time, then he will develop a mental cope-up mechanism for that. And that cope-up mechanism could be anything, and that would differentiate into different homeopathic medicines. But that coping mechanism can cause BPD also. Next is neurobiological factors. Studies have found differences in the structure and function of certain brain regions in individuals with BPD, particularly areas involved in emotional regulation and impulse control. So what neurobiological factors is telling, that the particular areas which involve in regulation of emotion, which involve in impulse control, these neurobiological factors can contribute in causing a person BPD. Okay, so these neurobiological differences may contribute to emotional dysregulation, may contribute to impulsivity, and may other symptoms that are observed in BPD. Okay, so there could be some center in your areas and brain which can cause BPD. Okay, then there are some environmental factors such as chronic stress, unstable family environment, inconsistent parenting styles, and this can develop towards BPD. Okay, so borderline personality disorder can be developed through inconsistent parenting or unstable family environment. As we have already discussed, that childhood is a very important part in developing a mental disorder. So these are obviously interconnected. Then there is temperamental factors. Certain temperamental traits such as impulsivity, emotional sensitivity, and high levels of reactivity may increase the risk of developing BD. So if a person have temperamental traits such as impulsive, he is very impulsive, as we have already talked about, or could be very emotionally sensitive, then that could lead to different kinds of disorder. As we have already read in histrionic personality disorder, that emotionally sensitivity can cause histrionic. So this also consists of that. It's important to note that while these factors may increase the risk of developing BPD, not everyone exposed to them will develop this disorder. As we were talking, that if both the parents are suffering from any mental disorder, then the child could be, there are 75% chances that the child could be suffering from a mental disorder, but there are 25% chances that he would not be suffering from any mental disorder. Okay, so these traits could be causing diseases, but these traits are not surely causing disease. Okay. There are some psychological theories also which explains or which tries to explain borderline personality disorder. These theories focus on various aspects of personality development, attachment patterns, and cognitive processes. Let's try to understand these theories. The first is psychodynamic theory. So psychodynamic theory, such as those proposed by Sigmund Freud or later like Otto Kernberg, emphasize the role of early childhood experiences. Okay, so particularly disruptions in parent-child relationship can be the cause of development of BPD. Okay, and according to these theories, individual with BPD may have experienced significant trauma, neglect, invalidation during childhood, and leading to difficulties in regulating emotion and forming stable relationships. Okay, so the psychodynamic theory basically what it is emphasizing on is the early childhood relationship, that what his childhood relationship has been through with his parents and with his friends and with his families. Okay, then the next is attachment theory. Attachment theory was developed by John Bowlby and expanded upon by Mary Ainsworth. Okay, this posits that early experiences with caregivers shape an individual's attachment style. So, to and fro, we are talking about the parents. Now, the word has been used as caregivers, but we are talking about them only, okay? Which in turn influences their interpersonal relationship throughout life. Individuals suffering with BPD may have experienced inconsistent or abusive caregiving during childhood. So, if a caregiver who is mainly your parent is abusing or is physically abuser, or you are having an inconsistent relationship, then that could make you insecure, and that attachment pattern can cause fear of abandonment and difficulty in trusting others. Okay, so this theory talks about attachment with your parents or caregivers. Okay, there are three more psychological theories. The next is cognitive behavioral theory. This cognitive behavioral theory of BPD focuses on maladaptive cognitive patterns and dysfunctional beliefs. Okay, this contribute to development of maintenance of disorder. What it is? Maladaptive cognitive patterns and dysfunctional beliefs. These theories suggest that individuals with BPD may have negative core beliefs about themselves, about others, and about the world, which lead to distorted thinking patterns and emotional dysregulation. Now let's understand that. If a person has a negative core belief about this world, that the whole of this world are full of terrorists and everyone is out there trying to kill me, I have to learn something to protect myself, then that is a negative belief. And that negative belief can make you feel that since everyone is a terrorist around you, then no one will love you. You always have to protect yourself. You can't make a stable relationship. everyone is just for fun, and you can't make stable relationships with them, and you can't fall in love. There is nothing like love around your world. Okay, so this cognitive behavioral theory basically says that these negative impressions about yourself, about your family, or about this world can cause BPD around you, or sorry, can cause BPD in you. Okay. Cognitive behavioral interventions for BPD often target these cognitive distortions and aim to help individuals develop more adaptive coping strategies. Okay. Then there is dialectical behavior theory. Dialectical behavior theory, developed by Marsha Linehan, is a widely used treatment approach for BPD that integrates elements of cognitive behavioral therapy with concepts from mindfulness and dialectics. Okay. DBT emphasizes the dialectical balance between acceptance and change and focuses on teaching skills for emotional regulation, distress tolerance, interpersonal effectiveness, and mindfulness. So basically, dialectical behavioral theory is also there, and then there is a treatment, a dialectical behavioral psychotherapy. Okay, that psychotherapy makes you understand that you have to regulate your emotion in a certain way. You have to behave in a certain way according to certain stimulus. If someone is talking to you loudly, do not react loudly. Try to make them understand, or try to leave that environment. Okay, so this dialectical behavioral theory is very much nearby to that. This underlying theory of DBT suggests that individuals with BPD have difficulty in regulating emotions due to a combination of biological vulnerabilities and invalidating environments. Okay, so this theory basically believes that a person, if he is suffering from deep borderline personality disorder, then he have a difficulty in regulating various kind of emotions. Okay, then the last is interpersonal theory. Interpersonal theory basically believes that interpersonal difficulties experienced by individuals with the disorder may have a heightened sensitivity to interpersonal cues and may struggle to accurately perceive and interpret social interactions. This can lead to difficulty in forming and maintaining stable relationships. So basically, what we have to understand here is they are trying to say that if a couple is not able to make an interpersonal relationship work, okay, then in that case BPD is not only because of what they are saying. It is because of inaccurately perceiving and interpreting what interaction is going on. Okay, if someone is talking about something else and I am perceiving something else, then obviously that would not be helping in causing that relationship work. Okay, so this interpersonal theory talks about that only. Next is epidemiology. BPD is estimated to affect approximately 1 to 2% of general population. Okay. However, this figure may vary depending on the criteria used for diagnosis and the population you are studying. Okay. So 1 to 2% is, if we listen that, then we think that 1 to 2% is not very much. Okay. But when we try to understand that on the basis of the whole world, then we understand 1 to 2% is a humongous number of population. Okay. Then if we talk about gender distribution, BPD has been thought to be more prevalent in women than in men, but in more recent researches, it is suggested that gender distribution may be more equal than previously believed. Okay, so borderline personality disorder is not more common in men or not more common in females. It could be equally prevalent. Okay, but as we have already discussed, histrionic personality disorder is more common in women and antisocial in men. Okay, age of onset. The symptoms of BPD typically emerge during late adolescent or early adulthood. Okay. BPD can be diagnosed in adolescents. Clinicians may be cautious in making a definitive diagnosis. So, as we have already read in antisocial personality disorder, that you cannot make diagnosis of an antisocial personality disorder below 18. Okay. If a person you think is suffering from antisocial personality, then he should be more than 18 years. Then only you can write diagnosis antisocial personality disorder. But in BPD, there can be a diagnosis of below 18 with BPD, but you have to be cautious that you are making definitive terms for diagnosis. Okay, so be precautious for that. Then there is comorbidity. BPD commonly co-occurs with many mental disorders as mood disorders such as depression or bipolar, then anxiety disorder, substance use disorder, eating disorders, and etc. Okay. There is suicidality and self-harm, as we have already discussed in the first slide, that people are trying to self-harm themselves and trying to suicide. Okay, this is a continuous repetition, and that could make you understand that this person is suffering from BPD. Okay, Individuals with BPD are at increased risk of engaging in suicidal behavior and self-harming behavior, such as cutting or burning themselves. And the rate of suicide attempt and completed suicide are higher among individuals with BPD, okay, compared to the general population. Then the last is healthcare utilization. People with BPD frequently seek mental health treatment, including psychotherapy and medication management. So, if a person is suffering from borderline personality disorder, he would not be afraid of you as a doctor. He would try to make a relationship with you. He would try to make an engagement with you. Now, it's upon you which have to be understood. Which you have to be understanding about it. That this person could be borderline, and I can help him. Okay, so he would be trying to asking for help. There are some recent researches which I would be loving to discuss with you all. First is neurobiological abnormalities. Research using neuroimaging techniques such as MRI and PET scan have revealed structural and functional abnormalities in the brains of individuals with BPD. As we already talked that impulse control areas are affected by it. So MRI and PET scans clearly show that these abnormalities are often observed in areas involving in emotion regulation, areas involving impulse control, interpersonal processing, and providing biological evidence for emotional dysregulation and impulsivity characterized in BPD. So, since these MRI and PET scans clearly show that the area which are usually affected are areas of emotional regulation, areas of impulse control, and interpersonal processing. Okay, so this is the biological evidence for it. Then genetic and familial factors. We already discussed it that if a father or mother or both are suffering from a disease, then the individual who is of offspring would be at higher risk. So this talks about that only. Then early life experience. We already discussed in the psychological theory part that recent researches also emphasize that if there is a trauma in the childhood or if there is any kind of abuse in childhood, then it increases the risk of an offspring who could be suffering from any kind of personality disorder, specifically borderline personality disorder also. Emotion dysregulation. Emotion dysregulation is a core feature of BPD, and research has examined various aspects of this phenomena, include heightened emotional reactivity, difficulty identifying and labeling emotions, and maladaptive coping strategies. So, researches tells you that people have heightened emotional reactivity, okay, but they do not adapt as per the same, okay. So, if you are getting anger, if anger is very normal to you, okay, then people tell you that do the breathing mechanism. But if you are unable to do that breathing mechanism, or if you are doing it wrongly, then obviously that maladaptation can hamper you. Okay, it is the same way, but in the case of mind, that the labeling emotion and difficulty identifying and maladaptive coping strategies can cause that or can increase the risk of that. Treatment outcomes. BPD was once considered difficult to treat. Research has demonstrated the efficacy of psychotherapeutic interventions, particularly dialectical behavioral therapy, as we have already discussed that DBT is a behavioral therapy, and this can help reducing the symptom of borderline personality disorder. Recovery and resilience. Longitudinal studies have provided evidence that many individuals with BPD experience significant improvement in symptoms and functioning over time, with some achieving full remission. Okay, so people have been named as cured after these therapies. Okay, factors associated are better outcomes, including engagement in treatment, supportive social networks, and development of adaptive coping strategies. So if you have a better coping strategy, if your social society is supportive, and if you are fully engaged in treatment, then you can be cured. The next is diagnosis. How can you diagnose that a person is suffering from borderline personality disorder? The first is clinical interview. If a person walks in, then you have to understand that you have to talk him about the interpersonal relationship. If he even if he's suffering from a physical disease, may it be rheumatoid or may it be osteoarthritis, being a homeopath, we have to talk about mind. And if we go into the mind and we understand that there is a difficulty in interpersonal relationship, and if we get that there are suicidal tendencies or history of suicides, then we can discuss with the person that yeah, you are suffering from rheumatoid arthritis, but I think you are suffering from borderline personality disorder also, and I can help you with that. Okay, so the clinical interview is the most prominently important. We have to gather information about the individual symptom, personal history, family history, and current functionings. Then obviously we have to talk about DSM-5. There is a diagnostic criteria. If you consider with these points, and if your patient is taking all these symptoms, then yes, that person could be suffering from a borderline personality disorders. Let's talk about the symptoms. Frantic effort to avoid real or imagined abandonment. Okay. So if a person thinks that he is abandoned, a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. As we have already talked, that there is no shade of gray. It's already white or black. Okay. Impulsivity in at least two areas that are potentially self-damaging. That is spending, sex, substance abuse, reckless driving, binge eating. So if a person is taking this box, then also that's also +1. Recurrent suicidal behavior, gesture or threat, or self-mutilating behavior also. A person who is doing drug abuse are usually doing this kind of self SH. We call that SH, okay? So self-harming behavior is also in BPD. Affective instability due to marked reactivity of mood. So if a person is having episodic recurrence time and time through, so that can also be diagnosed. Chronic feelings of emptiness and inappropriate intense anger or difficulty controlling anger. If a person taking all these symptoms, then you can think in mind that this person can be suffering from borderline personality disorder. Then there is assessment tools. Obviously, there is an assessment tool known as DSM-5, and there are many more assessment tools. Since we have lack of time, we would not be discussing that. Rule out other disorders. If a person is suffering from, if you are thinking that a person is suffering from BPD, you have to rule out some other disorders such as mood disorders, anxiety disorders, or substance use disorders, even bipolar at some extent. If a person is suffering from BPD, then bipolar could be nearby. Okay, so you have to understand that. And you always should have collateral information. Collateral information as in confirming from the bystanders who have came with the patient. Could be friend, could be neighbor, could be parents. Anyone who is with the patient could be an informant for you. Okay, so understand that. Modern treatment. We have already discussed about dialectical behavioral therapy, so would not be discussing that. The next would be schema focused therapy. Schema focused therapy would be helping you understand what are the negative impacts or what are the negative thinkings which you have been carrying with yourself, and you have to avoid that. Okay, so schema focused therapy would be focusing specifically on that core part, which the psychologist would be understanding that you are that thing is wrong in you. Okay, and he would be trying to suggest that how you can enhance that, or how you can reduce that, not enhance that. Then there are medications. Obviously, these medications are not for BPD. These medications are as per anxiety or as per anger or as per sleep disorders. So if you are having problem with that, then the medications would be for that only. There could be mood stabilizers or epilepsy or any kind of symptoms which are comorbidity in the cases of BPD only. Okay. Then there are supportive services. Case management. What is case management is you have to understand that if a person is suffering from a behavioral condition, then it's always about its family or the environment which he's living. Okay, so you have to give him more care, you have to give him more support, you have to make him understand that there are people around you who loves you, who supports you, even if you reciprocate that feeling or not. Okay, so you have to encourage him, you have to provide him specific support groups, and you have to avoid that individuality feeling, which is very important in homeopathy. But you have to make him avoid that individuality feeling, and you have to make him feel as family. You have to make him feel that you are among us, you are one of us. Okay, obviously there is family and couples therapy, and there are self-management strategies. Couples therapy is basically done because people who are having difficulty in making an interpersonal relationship, obviously you will try to make them help that how this relationship can work. If a person is saying this, then you have to understand this and not something else. Okay, so that is why couple therapy is effective. People go for couples therapy, and that is effective in West more, but in India also now people who are educated trying to do it. Then there are self-management strategies. What is self-management strategies is very important in any kind of mental disorder. So we have to understand that people should have self-care practice. They should do meditation or walking or attaching to the environment. That is important for people. Okay, so we have to understand that there are healthy lifestyle choices which we should choose. Then there are management techniques and healthy lifestyle choices. There are eating habits. We have, if a person is doing binge eating in BPD, then we have to understand that, and we have to try him teach that you should avoid this. Okay. So these are some supportive services which we can provide in the help of management. The next is homeopathic treatment. If we are trying to take a mental health condition such as BPD in homeopathy, we have to understand that the consideration of totality of the patient symptom is the most important, okay? Including its emotional state, including its personality trait, the physical symptoms, any specific kind of triggers or modalities that can influence their symptoms, we have to take the whole of the case, okay? So in a case of mental health, we can't go therapeutic, okay? We can only go with on the basis of the whole of the symptoms, the totality of symptoms, okay? Based on this comprehensive assessment, the homeopath would then select a homeopathic remedy, obviously. Next, as everyone knows, and Dr. Dhanesh in the beginning only told that I'm a repertory MD, so I would be talking more about rubrics, okay? I have taken some 30 to 40 rubrics because BPD is a part where delusions are many more important. So I would just name them and then we'll go ahead, okay? From Kent repertory, we have 4: mind, emotions, changeable, mind, emotions, irritability, mind, emotions, anger, and anxiety. Okay. So these are the 4 rubrics which I have taken from Kent repertory. Okay. If any one of you who thinks that any more rubrics can be added from Kent repertory, please, if we will have time, then we'll discuss that. Okay. The rest of the many rubrics are from complete repertory. Emotions, impulsive, delusions, identity, alternating, delusions, persecuted, fears, they will be persecuted. Delusions, self-altered, thinks he is another person. Delusion being double. Now, if we see these delusions, then we understand that, yeah, BPD, in the person, the BPD is suffering from these kinds of delusions, okay? They have that identity crisis. And in homeopathy, we are full of these kinds of rubric where delusions is the most important part, okay? Then there is delusion, desire to die, delusion, desire to escape, delusion, desire to be alone, delusion, desire to be punished, desire to be injured, desire to be harming others, destroyed, desire to be deserted, desire to be hated, and desire to be despised. So these kinds of rubrics, we are full of them, okay? The next slide would not be of delusions. These rubrics reflect various emotional and mental states commonly associated with BPD, including feeling of despair, isolation, self-destructiveness, and hostility. Okay, we can use these rubrics and thoroughly try to understand that what kind of patient we are dealing with and what kind of medicines we should be choosing. These are the next 10 rubrics. These rubrics capture the profound feeling of emptiness, okay, dissociation, self-negotiation. So these are desire to escape from oneself, desire to disappear, desire to dissolve, desire to self-destruct, desire to vanish, desire to be invisible, desire to be annihilated, desire to be obliterated, desire to be eradicated, desire to be exterminated. Now, if you see these rubrics closely, then you will understand that these are not the rubrics of identity crisis. These are rubrics of mutilation, of self-harm, of suicidal attempts. Okay, so these are not the same rubrics as of previous slide. These delusions are talking about self-harm types. Okay, these rubrics capture the profound feeling of emptiness, of the dissociation and self-negotiation, which results in self-harm. I have taken some rubrics from synthesis repertory because synthesis repertory seriously talks about many rubrics. So the rest of the rubrics are from synthesis repertory. Ailments from disappointed, ailments from grief, ailments from rejection. These 3 rubrics are important because it talks about childhood development. Okay, so these 3 rubrics. The next are delusion, body part made of glass, identity crisis. Delusion, body parts, limb made of wood, again identity crisis. Delusion, animal transformed into. Delusion, mind and body separated, feeling of. So if we see these symptoms, we understand that these are of identity crisis. The person who is suffering from identity crisis could be seeing these symptoms. Animal transformed into, as if he's a cloud, dead are surrounding him. Now the next is, as we are talking about that this person sitting in a crowd feels alone. So detached, feeling oneself to be. Dreams, wide awake, floating sensation of. Delusions, homosexuality, because that is an identity crisis issue. Delusions, inferior being. Delusions, mirror being seen in. Delusion on a higher plane. Delusion on a smaller scale. Separate parts of body are. Delusions, shrinking objects are. And delusions, split being. So these are the rubrics which we are talking about are of identity crisis. Okay. If a person is suffering from identity issues, then these kinds of rubrics could be taken into consideration. Next, we will be talking about medicines. I think there are 5 to 6 medicines. We have enough of time and we can discuss that. Okay. So the first medicine which comes into mind could be oral metallicum. Since we have seen all these rubrics, so some medicines which came into my mind, I have written that only. Okay. If someone would be suggesting any more medicines, then we can discuss that. Okay. Oral metallicum is derived from metallic gold, known for its deep action and on the emotional and mental levels both. Individuals who may benefit from aura metallicum often experience feeling of worthlessness, despair, and hopelessness. So in BPD also we have read that there is a feeling of worthlessness. There is a feeling that he's alone in this world. He's forsaken. He's abandoned. So despair and hopelessness matches that. They have a strong sense of duty, strong sense of responsibility, and a tendency to be self-critical and perfectionist. Okay, so now understand that if a person is self-critical and he fails and fails and fails, so obviously he would be getting, and we have read that there is a suicidal tendency in aura metallicum. So if a person fails and fails and fails, then he thinks that, okay, I am a person who could be responsible for all these of things, and I am the guilty person. Okay, and then he would try to self-harm himself. Okay, so because he has a very high standards for himself, this is written. Okay, these individuals may have high standard for themselves and may feel a sense of duty and responsibility and to achieve success in their endeavors. They may be prone to depression and may experience intense feelings of self-condemnation when they perceive themselves to have fallen short of their own expectations, as we have been talking about. That if a person fails and fails and fails, then he thinks that I have fallen short of my own expectation, and this can lead to many behavioral problems and maybe BPD also. I have taken this content from James Tyler Kent and William Borek. Okay. Next is natramure. Natramure is derived from common table salt and is indicated for individuals who have experienced grief, disappointment, emotional trauma, particularly in relation to relationships. Since we have been discussing in BPD that people have difficulty in maintaining relationships, so natramure could be one of that. They may have difficulty expressing or processing emotions and may appear reserved or aloof. So a person suffering from this kind of disease could be behaving reservedly. Okay. So if a person of BPD is behaving reservedly and is having difficulty in forming relationship because of an emotional trauma, natramure could come in mind. Natramure individuals often have a strong sense of duty and responsibility and may struggle with intimacy and emotional connection, as we have been discussing. May appear reserved or distant as a way of protecting themselves from further pain. So people, basically natramure tries to do that, tries to distance himself from further pain, and that is why he's reserved. That is why he has a problem of forming that deep connection, forming of that love. Okay, and that may struggle to trust others or open themselves up emotionally. I've taken this from Constantine Herring, and Margaret Tyler. Staphysagra, the next medicine derived from seeds of Delphinium staphysagra plant, is known for its actions on the emotional and mental levels. Obviously, when we talk about this Staphysagra, we know that we are talking about indignation, we are talking about vexation. So Staphysagra should come in mind, that emotional mental levels, particularly in cases of suppressed emotion, suppressed resentment, and indignation. Individuals who may benefit from Staphysagra often have a history of emotional or physical abuse. So we have been talking about physical abuse in childhood, we have been talking about emotional abuse in childhood, and now it comes. Okay, leading to the feelings of powerlessness, resentment, and suppressed anger and victimization. Okay, they may have difficulty asserting themselves and may internalize their anger or frustration. They may experience sudden outburst of anger or frustration. They may have a strong desire for justice. So Staphysagra, if comes to you and talks that I want justice because this have been done to me, then you can understand that, yeah, this is a kind of BPD, but Staphysagra can be helpful. They feel a deep sense of betrayal when their boundaries are violated. This content has been taken from Honeyman, Constantine Herring, and J.T. Kent's book. Ignatia amara, St. Ignatius bean. Ignatia amara is derived from the seeds of Strychnos ignati tree and is indicated for individuals who experience acute grief, disappointment, and emotional shock. As we already know that when the word acute grief comes in mind, Ignatia comes on the sideways, that yeah, Ignatia could be there. They may exhibit mood swings, tearfulness, emotional sensitivity, and often response to loss or change. Ignatia individuals may suppress their emotion and put on a brave face and may struggle with inner turmoil and conflicting emotion. People say that no one sees Ignatia's tear because Ignatia cries silently. So no one sees their turmoil, what is going inside of them. Everyone sees the outside part and say that, yeah, this girl is brave or this person is patient. But there is a turmoil which is going on inside, and that could lead to BPD. Acute grief, loss or emotional shock leading to mood swings and tearfulness, sense of emotional vulnerability. These individuals may be highly sensitive and may have difficulty coping with loss or change. They may oscillate between period of intense sorrow and attempts to put on a brave face. Okay, 3 more medicines left. Lycopodium clavetum, derived from spores of club moss. Uh, let's come on the topic. They experience low self-esteem, they have fear of failure, they have performance anxiety, and they have a strong desire for recognition. They have a strong desire for success. They may doubt their abilities. They may feel intimidated by authority figures. That is why that rubric comes, that good for superiors and bad for inferiors. Okay. They have a strong need for validation. They may fear being exposed as frauds or failures. Okay. So that is why BPD interchanges with lycopodium. We can understand that lycopodium and BPD can be same, or a person suffering from BPD can get lycopodium. Thuja. Thuja, in a person, if we think of a patient as Thuja, then they have identity issues, because we are talking about psychosis. There is identity issues, there is feeling of alienation, there is sense of being different or separate from others. Those delusions which we are talking about, Thuja covers most of them. Okay. These individuals may have experienced trauma, rejection, leading to a deep-seated fear of abandonment or isolation. They have a difficulty forming authentic connection. Obviously, that is a problem in behavioral disorders. And with others may feel a profound sense of emptiness or disconnection, as we have already been talking about this in BPD. Okay. Thuja individuals may feel misunderstood or isolated and may have difficulty forming close relationships. Natrum carb. Natrum carb experience chronic feelings of sadness, isolation, dissatisfaction, and a sense of estrangement from themselves, often stemming from early childhood experience or family dysfunction. In this first paragraph only, we get that psychological trauma part of that BPD, which we have already been discussing. And this has been taken from Hahnemannian part. Okay. So if a person is suffering from chronic feeling of sadness, chronic feeling of isolation and dissatisfaction, and it's coming from childhood experience or family dysfunction, then natrum carb should come in mind. The last is stramonium, taken from Jimson Weed. The key author is Hahnemann, Constantine, Herring, and J.T. Ken. Stramonium, individuals who experience intense fear, anxiety, paranoia. As we have been talking about that there is a rage of anger, then there should be a medicine which should consider that rage of anger. So stramonium is there. Experience intense fear, anxiety, paranoia, stemming from traumatic experience or sense of being threatened. As we talk that there are all terrorists around you. So sense of being threatened and may feel constantly on guard against perceived dangers. They may exhibit aggressive or violent behavior when feeling threatened or vulnerable. Stramonium individuals may have a strong need for control and may struggle with trust and intimacy in relationship. They may exhibit aggressive behavior and defensive behavior as a way of protecting themselves and the harm. This was all for the day, and we have been talking about behavioral personality disorder. And thank you very much.
Thank you, Dr. Manish. It's really a very good session. You have presented various sub presentation on personality disorders, and today it was on borderline personality. Anyway, I am congratulating you for making such a beautiful presentation in this forum uh, uh, within a short time. That's really great. And those who want to have a chat with Dr. Manish can raise your hand and we can allow you to unmute. I think Dr. Ramper is waiting for that. Sir, you can begin the session.
Thank you, Dr. Dhanesh ji, and congratulations, Dr. Manish Singh Azad ji. Very nice presentation, excellent session, peculiar session. BPD. BPD really mental symptom, anger, grief, anxiety, etc.
Yes,
Very many kinds of medicine deals aurum metallicum, natrum, mur, lycopodium, ignatia, natrum car. Very thanks. Very nice presentation. EPD, personality disorder. Thank
Thank
you.
you, sir.
Invite Dr. Bob Lim. Dr. Bob Lim. Or if anyone want to say anything, you can talk. I think Dr. Sridhar Kursa can say something about the subject. Yes. Bob Lim. Yes, Doctor.
I'd like to thank Dr. Mani for a very detailed explanation on BPD. And yes, it covered very basic until the high level, until we can do a treatment with the various homeopathy remedy. And that is very good. We understand how to approach the cases and how to diagnose the cases. That is brilliant. Thank you.
Yes, really. That's what.
Thank you, sir. Thank you very much.
Knowing such things are very important to diagnose the case, even though we have a different way of approaching homeopathy, but understanding something is great. Yes. Now I invite Sridhar Kursa to say, because sir is a person who is dealing with all kind of mental diseases.
Lord Sab, it was a wonderful section, excellent, very good, but your speed is little high, sir. Please reduce not 100 mile speed or 90 mile speed. That people cannot follow that much speed. Sorry, don't feel bad. For the improvement, I am telling.
No, sir. No, sir. Yes, sir. Thank you, sir.
Okay, next time you please care about it, that your sections are in homeopathy. There are excellent remedies, more than that of the psychological interventions, better remedies are there, along with the interventions. That intervention means psychological, that the psychotherapy and counseling and so many other techniques are there. About 15 to 20 techniques are there. Of course,
Yes,
all it is effective. Along with that, more than that, our homeopathic medicine, if they may take 2 months or 3 months, several sittings. That because I learned that the counseling and psychotherapy and all other alternative methods also I am practicing. That is why I am telling confidently. I am telling that along with that, homeopathy also will give reduce to the time. If it may take 1 month or 2, 3, 4 months, we can cure it within 2 weeks. That is this. Even homeopathy alone also can change to the physical and mental and emotional level. That is my opinion and my personal experience. Thank you very much. Come again with such a wonderful class. It is very useful. Well, but it is little high speed. Otherwise, you are absolutely all right. Very good. Excellent. Thank you very much. Come again. I give that the thanks for you. I don't know whether anyone is they are ready to say thanks. Then I stop here.
Yes, sir. Sir can say the auto thanks also because.
Yes, I am telling in behalf of our IFPH that all this class was excellent. Come again with such another subject and come most welcome. And I also thank all the audience, that especially doctors, that the students and the homeopathic lovers also, all the who are assembled here. I don't know, about only 37 people are here. So, but still, that it was, I am giving my sincere thanks each and every person who is attending continuously our IFPH forum. Thank you, one and all. Bye. Good night. Our Malayalam section is going to start. Please hand over to this section, to our Malayalam section. Thank you.
Thank you, Sridhar Kursa, for a beautiful auto thanks session. And now, thank you, Dr. Manish, once again. And tomorrow we will have a session from Dr. Asha Varghese, and she will be talking about this PCO and its homeopathic management, a different subject and very important subject. With that, we come to the end of the day, 1310. Thank you all. Good night.